Okay, so hello everyone. I'm really glad to be here again in this latest expert session. Hello Matteo, hello Gianluca, hello Dr. Raja. I'm here with two experts. They will talk about our topic from today is actually why do heart centers need a subspecialty entirely dedicated to coronary surgery? I have two experts here, Gianluca from Philadelphia and Dr. Raja from Royal Brompton Harefield. And I will start with this first question. Please, Gianluca, give us an introduction. What do you think that coronary surgery, we know that coronary surgery is what was one of the techniques that really improved ourselves as a specialty, but a lot of people think that's the butter and bread surgery. But I think that we need to go deep in this topic and explain why each heart center really need a guy that can do the entire spectrum from coronary surgery.
Thank you. First of all, thank you so much, Tulio. Thank you, Matteo. It's great to be here and a great opportunity to discuss and great topic. As you know, is one of my deep interest, niche of interest, coronary artery, bypass grafting, and coronary surgery. And the way I personally believe is the presence of coronary surgery is the need of specialists within every center capable of performing any type of procedure. For too many years, we have really believed that coronary bypass grafting can be performed by anyone. And in one way, yes, it's true, like coronary bypass should, every surgeon, every cardiac surgeon needs to know how to do an AVR. I can do an aortic dissection, and every surgeon needs to know basics of mitral valve, like every surgeon needs to know how to do a P2 prolapse repair. But the reality is that patient allocations, patients with coronary artery disease and patient allocation, being able to sit in a heart team meeting and being able to advocate for coronary artery bypass grafting and being able to talk with a solid knowledge of literature about what has been published of PCI versus bypass grafting in the last 20 years requires someone who dedicates his profession for this type of disease. And more, the quality of the patients that we are treating in just the last 10 years, so when I originally start my training to now when I'm actually practicing my surgery, I see that the type of patients that goes for a coronary artery bypass grafting are very different than patients just 10 years ago. And different patients means that you need someone capable of performing any type of techniques currently available that include on pump, that include off pump, that include multi-arterial or total arterial bypass grafting, that include minimal invasive or robotic coronary surgery. When you look at the big numbers by the STS, the number of second arterial conduit that we are still currently using in the United States of America is ridiculously low. And one of the major reasons is exactly one of the major reasons of this low adoption is that too many surgeons are performing bypass grafting. We need more experts that take their time and dedicate themselves in performing more multi-arterial bypass grafting and can advance this field of coronary surgery. That's my elevator pitch.
Thank you very much for giving me the opportunity to be part of this discussion. In response to your question, I'm sure we all know that coronary surgery is perceived as a generalist procedure. However, in reality, coronary surgery is not just doing left internal mammary artery and two vein grafts on cardiopulmonary bypass. It's far more complex. And I think, for the sake of recognizing it as subspecialty, we first need to recognize that there's a huge spectrum of interventions that we can offer to patients who require coronary artery disease and are referred to us for coronary surgery. And I would I would start by saying that there is at the base, I call it the pyramid of progression or pyramid of subspecialization. And when we talk about the pyramid of subspecialization, at the bottom you have conventional coronary surgery on cardiopulmonary bypass, which in my opinion, every cardiac surgeon must perform to the topmost standard. all our cardiac surgeons should be trained to perform a lima and two veins on cardiopulmonary bypass. However, this is not an operation that you can offer to every patient because one size does not fit all. So there's further iterations of this operation which specialist coronary surgeons must learn and must perform. And that is why there is an argument for making coronary surgery a subspecialty. And if you want me to be more explicit, I would say complex coronary surgery has to be a subspecialty. So you straight away differentiate your generalist coronary surgery from your specialist coronary surgery. And when we talk about specialist coronary surgery, that involves the use of multiple arterial grafts, something which as a specialty we don't do much. I'm sure you're aware of the fact that it's about 4% of surgeons in the States and pretty much the same number of surgeons using multiple arterial grafts in the UK. And that's a very disappointing thing to see for someone who is quite aggressive in his approach towards treatment of coronary artery disease as a surgeon. Similarly, we need to be focusing on reducing the rates of strokes, iatrogenic strokes that coronary surgery can give to patients. And for that, we have to look at strategies which would increase the adoption of aortic coronary surgery. So I think, that's an extra dimension to coronary surgery. On top of that, we need to train specialists to perform coronary surgery without the need of cardiopulmonary bypass. And I'm not going to go into the details of whether off pump is better or on pump is better, because I think that's a very academic debate. And I think if you want to be a specialist coronary surgeon, you've got to think beyond this debate. And thinking beyond the debate means that you need to be able to perform an off pump operation on a day when somebody that has been referred to you requires this procedure. So clearly, there's for a specialist surgeon, there's a need to learn, off-pump coronary artery bypass grafting. And on top of that, I mean, we're living in an era of minimally invasive cardiac surgery. So, our specialist coronary surgeon has to be trained to perform all of these procedures through minimal access approach. I think, eventually, and this is my view, and people can disagree with me, but my perception is that in the next decade, majority of the cardiac surgery will be performed through minimal access approach, and that includes coronary surgery. So if you are, becoming a specialist coronary surgeon, you would have to learn to perform all the coronary procedures through a small incision, preferably with the use of either an endoscope or a robot. So I think, the wide spectrum of coronary surgery has to be taught to a specialist coronary surgeon. And that is why, I'm a big believer that in 2030 and beyond, every center should have a specialist coronary surgeon who should be able to offer the full spectrum of coronary artery surgery.
My question is, I mean, coronary bypass grafting is maybe the most commonly performed surgery, or one of the three most commonly performed surgeries in cardiac surgery. So my concern, and I'm trying to argue against the let's say a high volume coronary center. My concern is that maybe if it is too centralized, maybe people might lose access to coronary surgery. What do you think about it? Do you think it might affect the patients in maybe more isolated places where they don't have so much access to big centers? What's your opinion about that?
Look, the reality is that if you wanted to specialize, if you want to offer better quality of surgery, you need to create center of excellence. We have seen this one in mitral valve surgery. There is a beautiful editorial that is written in 2012 by Stephen Bolling, and said that the problem of mitral valve, the low adoption of mitral valve repair, and he was taking some data from STS of 2000 and 2010, and the low adoption of mitral valve repair at that time was caused by the fact that too many surgeons were performing mitral valve. I believe we have to be a little bit more careful, because a lot of patients are getting into it, and creating only center of excellence can create this culture or can potentially redistribute allocation of patients. But the reality is that we are not talking about reducing the number of centers. We are saying improving the quality of surgery that is performed at each one of these centers by creating more culture about the fact that in each center, there should be someone capable of performing a second arterial conduit, advocating for using a bilateral internal thoracic artery, capable of skeletonizing two mammary artery, or performing an off pump when you encounter a patient with a complete calcified aorta. Now, the robotic, the minimal invasive, the thoracotomy, all off pump, they might really still believe to the niche where patients travel around the world. You know, we all travel for leisure and pleasure. We take expensive flights around the world. And I always very surprised how patients with stable coronary artery disease still goes to receive their most important surgery in their own life that has the most important outcomes for the next 10 years or 20 years of their own life in the place just beside their home. So probably certain type of surgery should be performed only in very highly specialized center, but there is a value in advancing the field of coronary surgery in every center by creating more culture and creating dedicated surgeon who takes this job and this type of surgery a little bit more serious.
Well, in response to this question, I would say that, you know, we cannot centralize coronary surgery for the simple reason that, you know, the volume of coronary surgery that we perform annually worldwide is massive. You do around 800,000 coronary artery bypass operations worldwide. So I think, you know, if you try and centralize these operations in certain select centers, what you're going to do is you're going to firstly deny the coming generation of surgeons the opportunity to learn coronary surgery, because, you know, there's this perception that, you know, high volume means good outcomes. But at the same time, what we need to understand is that the outcomes for coronary surgery are already at perhaps the best that they have ever been. You know, you have a mortality of less than 1 or 1.5%, and the stroke rates are probably less than 2%. So I think, you know, if we want to completely eliminate all of this, we would obviously need to make sure that we, you know, improve further upon what we are already doing. And I think, you know, centralizing coronary surgery essentially would mean that patients perhaps would be, you know, having an issue with access to coronary surgery, because not all patients would be able to travel long distances. And at the same time, you know, my vision of subspecialization is not centralizing coronary surgery, but making sure that every center has an individual who's trained to do the full spectrum of coronary surgery, which is a completely different concept. So essentially, you know, you're giving your average patient, you know, an operation which, you know, a general coronary surgeon or a general cardiac surgeon can offer. But on a day when you have somebody who's, say, got a porcelain aorta, there is a specialist available in a center to treat that patient who clearly requires a different operation from the conventional on-pump, you know, coronary artery bypass operation. Similarly, if on a day, you know, someone comes to your unit and requires arterial grafting, you need to be able to offer this patient the expertise to perform multiple arterial grafting. And that would only happen if we focus on subspecialization in coronary surgery and ensuring that we are able to offer training to our future generation of coronary surgeons. It will be very difficult to get existing generation of surgeons to change their mindset and change their approach. But I think what we need to do is we need to focus on the up and coming surgeons. We need to make sure that, you know, there is a recognition of coronary surgery as a subspecialty by all the key societies around the world. I think that would be the first step. Till we recognize coronary surgery as a subspecialty, and I'm not talking about the conventional on-pump CABG, which is the standard operation, but I'm talking about beyond conventional CABG, which is the use of multiple arterial grafts, the use of anaortic approach, the use of minimal access strategies, and obviously the use of, you know, innovative approaches like robotics and endoscopic coronary artery bypass grafting. Only then we will be able to ensure that we have a specialist coronary surgeon in every center around the world. I think centralizing coronary surgery may not necessarily achieve the same objective, because as a result, you are going to deny a huge proportion of the population the access to coronary surgery, and they may be offered, suboptimal treatments, which may not necessarily be, the vision that I have and the vision that all of us should have. What we should be aiming for is access to the best available options that are out there. And the way to ensure that would be to make sure that we have specialists available in every center who can offer the full spectrum of coronary surgery to our patients.
Okay, perfect. It sounds really good. So we really appreciate your answers and thank you very much.
Julio, fantastic.